functions of the seminal vesicles. It produces secretion which is added to the spermatozoa during the ejaculation. What is the function means? The produces the secretion of the sperm which is added spermatozoa sperm during the ejaculation. Next one is the prostate gland. What is prostate gland? Prostate gland, it lies below the bladder. It is situated on the lies below the bladder. It is pelvic cavity. It is a pyramidal in shape. The prostate gland gradually increases its size. From birth to puberty. Next, what is the function of prostate gland? What is the function? It secretes an alkaline milky fluid. Which neutralizes the acidity of semen. And vaginal secretions. Thus, greatly increases fertility rate and motility rate of the sperms or spermatozoa. Means it is very important role in the function in the prostate gland. It secretes an alkaline milky fluid which neutralizes the activity of semen and vaginal secretion. Thus, greatly increases fertility rate and motility rate of the sperm. You see the diagram of prostate gland. This is the pyramidal shape this is prostate. Okay. Next, what are the constituents of semen? What is the semen containing the 2 or more types of liquids? These liquids, okay, what is the pH of semen? Semen pH is the 7.2 to 7.6. okay. What is semen? Semen is the fluid ejaculated during the intercourse. Semen is a fluid ejaculated during the intercourse from urethra. The semens, it consists of first one is the spermatozoa or sperm and viscous fluids which helps to nourish the sperms. Next, mucus secreted by lining of the glands. Means mucus layer, to form a mucus layer secreted by the lining of these glands. Next, the antibiotic semen plasmin which has ability to destroy the number of bacteria. The antibiotic semen plasmin which helps to ability to destroy the number of bacteria in the vagina or the root of the vagina. Next, what is spermatogenesis? Okay. The spermatogenesis, it is the process of formation of motile sperm from spermatogonia. Means the spermatogonia is converted into motile sperm. There are 3 phases. First one is the multiplication phase, second one is the growth phase, third one is the maturation phase. You see the diagram or chart, you see the chart. The first is the multiplication phase. In the multiplication phase, the spermatogonia is the 2N. 2N means it is diploid cell. Okay, you know the diploid cell. The spermatogonia is the form of diploid cell. That diploid cells is once again is converting to the diploid cell, that is primary spermatocytes. The spermatogonia is converted to primary spermatocytes with the help of mitotic division process. Primary spermatocytes, it is also called as a diploid cell. Okay. After multiplication phase, they will go for growth phase. Growth phase, the primary spermatocytes is converted into secondary spermatocytes. Primary spermatocytes is converted into secondary spermatocytes with the help of meiosis 1. Okay, meiosis 1. Here diploid cells is converted into two haploid cells. Diploid cell, primary spermatocyte is there, diploid cell is converted into secondary spermatocytes. These are the haploid cells. These two, one diploid cell is converted into two haploid cells. These two haploid cells once again they be converted into meiosis 2 process. The meiosis 2 to form a 4 spermatids. The 2 haploid cells is converted into 4 haploid spermatids with the help of meiosis 2 division. Meiosis 2 division, there are 2 cells is converted into 4 spermatid cells. These 4 spermatid cells, these are non-motile cells. Okay. Next, the 4 spermatids in the maturation phase. After the spermatids, these are the non-motile cells. These cells maturation takes place in the process of spermigenesis. It is the process is spermatids is converted into sperm. That is, spermatids is converted into motile sperm. That is the motile sperm and maturated sperm or spermatogonia. This is the process of spermatogenesis. You see the diagram of, or you see the chart. This is easy to learn how to the process takes place. And another one, animated diagram is there. You see the animated diagram. You see the diagram of the animated. The single haploid cell is converted into single diploid cell is converted into 2 haploid cells. These 2 haploid cells is converted into 4 spermatids. These 4 spermatids is converted into spermatozoa. Okay, you see the animated diagram. It will helpful for your imagination. Or next you go for the structure of sperm. You see the structure of sperm. This is sperm is a motile sperm. It is to form some acrosomal enzymes, and these containing head, body and tail. There are 3 parts of the sperm, containing 3 parts. First one is this is the head part. Okay, this is the head part and this is the body part. Last is the tail part. First head part. The head part containing the acrosomal cap. The acrosome is the one of the enzyme. Okay. Next, second part is acrosome. This is the acrosomal cap. Inside the cap, that is acrosome. Next, the center of the head, that is nucleus. This nucleus, below the nucleus, that nuclear membrane. Next, in the part of body, that proximal centrioles. It is the proximal centriole. After proximal centriole, in the body part, the mitochondria, dense fibers, microtubules and annuals. And next, tail part containing flagellum and fibrous sheath. Next, circumferential fibers, axial, filament and end piece. These are the parts of tail. Very important in the examination, write the structure of sperm. You see the structure, there are 3 types: head, body and tail. You write the some acrosomal cap, and in the inside of the acrosomal cap, that is acrosome, nucleus, nuclear membrane, proximal centriole and mitochondria. In the body part, mitochondria, dense fibers, microtubules, annuals, flagellum, fibrous sheath. And next, tail part, fibrous sheath, circumferential fibers, axial, filament and end piece. These are the structure of sperm. Next, they go for the female reproductive system. The male reproductive system is completed. Next, they go for the female reproductive system. The female genital organs can be classified into secondary organ, external genital organ and internal genital organ. In the secondary organs, that is breast, it is also known as mammary gland. The external genital organs, mons veneris, labia majora, labia minora, clitoris, hymen. These are the external genital organs. In the internal genital organs, vagina, uterus, ovary and fallopian, these are the internal genital organs. Now directly for the first organ, that is secondary sex organ, that is breast or mammary gland. What is breast? Breast is a glandular tissue overlying on pectoral muscles of the chest. It is located on the chest cavity. They are pair of breast located on the chest cavity. Okay. Next, these are accessory sex organs in female which secretes the accessory sex organ in females which secretes the milk. Okay, the milk producing part of breast is organized into 15 to 20 sections called as lobes. Milk production parts of breast is organized into 50 to 20 sections. These sections called as lobes. Each lobes are made up of small structures. Each lobes made up of small structures called lobules. You see the diagram. This is the muscle. This is the fat. The fat is covering on the layer of the breast, outer layer of the breast. This is lobes. These lobes are inside the lobes. They are collecting the milk. This is alveolar canals. These alveolar areola canals. These areola canals. These are the ducts. There are 2 or 3 lobes connecting between the duct. That duct directly connecting to the nipple. These nipples ejaculated the milk. Next, milk travels through a network, that is tiny tubes called as lactiferous duct. These duct is also called as lactiferous duct, which passes towards the duct which passes towards the nipple. What is the function of breast? After childbirth, the prolactin hormone of the anterior pituitary secretes the milk, while oxytocin helps to ejaculation of the milk. The first function is the after the childbirth, the prolactin hormone. It is one of the anterior pituitary hormone. These hormones secretes the milk, while oxytocin helps to ejaculate the milk. Next, you see the next female. You see the diagram of female reproductive organ. You see the diagram. Okay, this is the. You see the diagram of this is labia minora, labia majora. This is, and this is clitoris. Okay, clitoris. This is the pubic bone. This is the long tube is the vagina. This is the end of the vagina and opening of the uterus is the cervix. This is the uterus. This is uterus. This is the ovary. This is fallopian tube. Okay, these are the diagram of the female reproductive organ. Next, they will directly go for the external genital organ. The first secondary sex organ is completed. Next, external genital organs. You see the diagram of the external genital organs. There are the first one is the mons veneris. Mons veneris, it is the fat lying in front of symphysis pubis, which is covered with pubic hairs at puberty. Mons veneris, it is a fat lying in the front of the symphysis pubis, which is covered with pubic hairs at the puberty or at the age of 9 to 14. Second one is the labia majora. Labia majora, there are 2 large folds. Labia majora, this is, you see the diagram of labia mons veneris. Okay. Next, mons veneris of the covering here of the this is mons veneris. See the mons veneris. This is next labia majora. The labia majora, you see the diagram of labia majora. Okay, there are 2 large folds. These are 2 large folds which form a boundary of wall. It is to form a boundary, to form a boundary of the wall. Okay, this is the wall, this is the boundary of wall. Okay. Next, labia minora. Labia minora, these are the two small folds. Here in the two small folds, these are the two small folds of the skin situated between the upper part of labia majora. Upper part of labia majora. This is the two fold. Labia majora. Okay. Next, clitorius. Clitoris, it is the clitorius. It is a small erectile tissue. It is a small erectile tissue situated at the apex of vestibule. It is sensitive and responses to the penis. Okay, this is the responses to the penis or to help to the, okay, it helps to the ejaculating process, erectile process. It is help to the erectile process of the penis. Next, hymen. It is the hymen. It is the thin mucous membrane which cover the vagina of the orifice. It is perforated centrally to allow the menstrual discharge. It is the hymen. It is a thin mucous membrane which covers the vaginal orifice. It is perforated centrally to allow the menstrual discharge. Next, they will go for the internal genital organs. Okay, internal genital organ is the first one is the vagina. This is the vagina. This is the vaginal cavity. Okay, the vagina, it is the canal made up of muscular wall. It is also known as muscular wall. It extends from vaginal orifice to the cervix. This is the cervix. The cervix means this is area is the cervix. This is the end of the vagina. This is the vaginal part. This is the cervix. Means this is the fold orifice. It is vaginal orifice. The continues the cervix. This is the cervix to enter the uterus. Okay. A small projection of vagina above the outer surface of the uterus called as a fornix. Means this is the larger area of the vagina. After they will small projection. These small projection of the vagina above the uterus, surface of the uterus called as fornix. This is the fornix. Next, uterus. This is the center of the, this is the uterus. Uterus or womb is a hollow muscular organ situated in the pelvis. It is covered by peritoneum. It is covered by the peritoneum cavity. Okay, it is lies in between bladder and rectum. It is lies area between the bladder and rectum. The uterus is divided into three parts. Okay, the uterus is divided into three parts. First one is the fundus. It is the fundus part. Second one is, this is the body part. It is cervix part. There are three parts of uterus. First one fundus, body and uterus. Next, ovaries. The ovaries, these are the two in numbers. The ovaries are in two in numbers. They are lie on the either side of the uterus. The ovary attached to the fallopian tube, which helps to the ligament. Means the ovary attached to the fallopian tube, which helps to of ligament. The structure of ovary and continuous. What are the structure of ovary? First one is the central soft tissue called as a stroma. Central soft tissue is called as a stroma, and outer surface is called germinal epithelium. In the central soft tissue of the ovary is the stroma. Next, the outer surface of the ovary is called as germinal epithelium. Next, what is the function of ovary? What is the function of ovary? The first function, the formation, development and liberation of ovum from germinal epithelium. Okay, what is the formation, development and liberation of ovum from germinal epithelium? Next, second one is the secretion of estrogen by Graafian follicle. Secretion of estrogen by Graafian follicle. next function, the secretion of progesterone by corpus luteum. Next one is the fallopian tube. Fallopian tube or uterine tube, both are same. Okay, it is also known as a uterine tube. These two in number, the fallopian tubes, they are two in number. Okay, the arises from upper angles of, it is arises from upper angle of the uterus. It is made up of a following layers. They are made up of a following layers. The first one is the outer peritoneal layer, second one is the middle muscular layer, third one is the inner mucous layer. The fallopian tube containing a three layers. These layers, first one outer peritoneal layer, second one middle muscular layer, third one is the inner mucous layer. What is the function of fallopian tube? The fallopian tube, it acts as a passage from ovary to uterus. Means the passage through the fallopian tube with the help of mucous layer to passage of ovum from ovary to uterus. Okay, ovary to uterus. Ovum transported or passed from ovary to uterus. Next is the fallopian tubes. It helps to fertilization of ova and sperm takes place in this tube. Only means the fallopian tube, in the very important role in the fallopian tube, in the ovum and sperm is fertilization occurs in the only fallopian tube. Okay, after this fertilization and they will the ovum is fertilized ovum come into the uterine wall, uterus. Next is the important bit is the ovulation. What is ovulation? What happens in the ovulation? Okay, first one, the maturation of Graafian follicle. Okay, the maturation of Graafian follicles and liberation of ovum is termed as a ovulation. Means the maturation. You see the diagram of this is corpus luteum. You see the diagram of white color, corpus luteum. The corpus luteum is converted into the early corpus luteum. That early corpus luteum is converted into liberated ovum. That liberated ovum ruptures takes place. Okay, that is ruptured particle. This is known ruptured follicles. That ruptured follicle, okay, that ruptured follicles. Okay, next the mature. Okay, you see the diagram in the process of this is the going to form a small worm. That worm is converted to primary follicles. These two are primary follicles. After the developing follicles, they are larger than this. Okay, after developing the follicles, the secondary worm. Okay, that secondary, this is the secondary worm. That secondary worm matures. Maturation takes place in the Graafian follicle. After the maturation takes place and once they are ruptured. Once again, they are ruptured. Rupturation takes place to liberate the ovum. This liberated ovum, that early corpus luteum and corpus luteum, finally the corpus albanicum. Okay, this is the ovulation process. Next, the ovary contains Graafian follicles. These follicles are about 40,000 in number. They are formed during the fetal life, the life of the woman. The 40,000 of number of follicles are developed. Okay, the rest of get degenerated at the menopause. Okay, you see the diagram of first one is the oocytes to form the, this is the oogenesis. The oogenesis and the same the process. Okay, the oocytes is converted into, and ovulation and oogenesis both are same process. Okay, this is the, once again I will explain you. Okay, this is same of oogenesis and ovulation, both are same. The cycle will diagrammed as here chart. Okay, this is same chart. You see the same process. This is the oogenesis. Next is the menstruation, very important in the female reproductive system. The menstruation, it is one of the menstrual cycle. Menstruation or menstrual cycle, it is a cyclic phase of the flow of blood with sheds of endometrium from the uterus. Women at the monthly interval is called as a, means it is a cyclic phase, blood flow with the sheds of endometrium from the uterus of women at the monthly interval is called as a menstrual cycle. The menstrual cycles, there are three phases of menstrual cycle. First one is the destructive phases or proliferative phase. Both are same. First one destructive phase, second one is the follicular phase. Okay, third one is the luteal phase. Okay, third one is the luteal phase. In the proliferative phase, this is the menstrual phase, or it is also known as a bleeding time or menses time. Okay, in the proliferative phase, it is characterized by the releases of estrogen during this endometrium get proliferated. It get renewed. In this period also, Graafian follicle is maturing, and this phase lasts for 10 days. And it is terminated when ovulation occurs. In the ovulation occurs, it will be terminated and estrogen production is inhibited in this stage. Okay, you see the diagram of here 1 to 9. These 5 days are the menses day. After the 5 days, the 11th day, that is the proliferative phase. Second one is the follicular phase. Okay, second one is the follicular phase. In the follicular phase, it extends from the next 9 days. During this time of repair of endometrium occurs. In the follicular phase, it extends for the next 9 days. During this time, repair of endometrium occurs. Means it is repair of endometrium occurs in the 9th day. Okay. At this stage, Graafian follicle of ovary mature and ova developed the inside. Around the 14th day of the menstrual cycle. The Graafian follicles ruptured and release the ova. In the 14th day, the Graafian follicle ruptures takes place and releases the ova. The Graafian follicles now become corpus luteum. Okay. In this follicular phase, the Graafian follicles now become converted into corpus luteum. Okay, next, luteal phase. In the luteal phase, following ovulation, it is characterized by the development of corpus luteum, the secretion of progesterone and preparation of the endometrium. In this luteal phase, the phase followed by ovulation, it is characterized by the development of the corpus luteum, the secretion of progesterone, the preparation of endometrium. Once again, they will, after the flow of bleeding, that once again the preparation of the endometrium to form a thick endometrium, form a implementation of fertilized egg. Implementation of the fertilized egg in the fertilization takes place. In the normal, they will once again endometrium they covered. After the formation of thick mucous membrane to block the cervix. These thick cervix mucous membrane, they block the cervix. Once the egg passes out the fallopian tube. Once egg passes to the fallopian tube in the fertilized ovum. In normal ovum, they will easily once again they will rupture and flow the bleeding. After they will start the destructive phase. It is also called as menses phase. Once again the cycle will be continued. Okay, see this diagram, the chart will be continued. First one, the menstrual phase, follicular phase, and luteal phase, and next they once again they will convert it into rupture takes place and once again menses to form. This is the development of follicle and mature follicle, and 14th day will be this chart. In this chart, in the 29th menstrual cycle, they will what is the action of pituitary hormones level in the takes place in the normal days, means 1 to 9 days, 1 to 13 days. They will gradually normal level to maintain the follicle stimulating hormone and luteinizing hormone. In the ovulation day, they will gradually or drastically increases the FSH and LH. Once again after the 14th day they will cross, they will on 17th 18th day the declared the follicle stimulating hormone and luteinizing hormone. After the 17-20 days they will once again they will the declared phase and they will go for normal position. Okay, this is the diagram of the menstrual cycle. This is a chart, very important chart. It is day 1 to 29 day. Next, last bit of the reproductive system, menopause. What is menopause? Okay, menopause, it is the period which occurs between the age of 45 to 50 years. Okay, making the end of the child bearing period. This is due to the ovaries normally become less responsive to the follicle stimulating hormone and luteinizing hormone stimulation, and it is characterized by flushing and sweating takes place. Shrinkaging of breast. Okay, the breast will shrinkaging takes place in this year. Shrinkaging takes place, and next atrophy of the sex organ. Okay, the atrophy means they are small size. Atrophy of the next, pelvic hairs become sparse. And episodes of undefined behavior. Okay, undefined behavior. That is the causes of menopause. Okay, what is the menopause condition? The menopause condition is cessation of the woman's reproductive ability. The reproductive ability or sexual ability will be decreases. It is usually natural changes which occurs in the woman's midlife during the late 45 to 50 years. It occupied by the following characters like this. Occupied by the following characters of the women, that is first in flushing and sweating, shrinkaging of the breast, atrophy of the sex organ, and episodes of the undefined behavior. Okay, this is the last bit of the sexual reproduction. Okay, thank you for the watching this topic. Okay, very important for your examinations. This is for only D-Pharma students. Okay, it will helpful for your examination also. Thank you very much.